Hi and welcome to my podcast, the Fertility, Motherhood and Wellness Show. True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. And as part of our True Stories, today we have in our studio Mrs. Kanupriya Pachisia. She's a friend, and I've also had the privilege of being her doctor. Welcome, Kanupriya, to the show.
Hi, Doc. Thank you for having me here. I always wanted to share my experience in some way or the other, and thank you so much for giving me this opportunity.
Thank you for being here. Kanupriya is a full-time mom and an accomplished interior designer. In her own words, I love music, and whatever free time I get in between playing the above two jobs, that is being a mom and an interior designer, I devote to my passion of singing. I've called Kanupriya to the studio here today because I wanted her perspective as a patient on how the first consult should be, what was her experience, and what advice she has to give to other patients out there. So, shall we start, Kanupriya?
Yes, of course.
My first question to you, Kanupriya, is why and when did you decide to visit a doctor?
So I decided to see a doctor when we decided we should think of planning a family. I just wanted to make sure I was medically fit to embark on this journey. I actually wanted to come for some preconceptual counseling. So, yeah.
Preconception counseling actually is something, it's a subject which is very close to my heart. And while in the West, it is very big. Most couples would probably go in for a preconception counseling before they actually try and conceive. But somehow in India, it hasn't caught up. Of course, I won't discuss this much here right now because I have an entire segment on preconception counseling coming on later. And maybe in a couple of days, we could have another session on just preconception counseling. So that brings me to my second question. How does someone decide to go to a particular doctor? There are so many doctors out there, and sometimes one gets confused between, going to a particular doctor or another. So how does one as a patient make a choice?
I think a lot of it is based on what everyone else thinks about a doctor. Or should I say it's based on only that for most of us. People tend to ask friends and relatives, and their good and bad reviews somehow shape up the image of a doctor. I think it's very important to read up on your doctor and do some homework yourself, rather than just go by what people say, because their reviews are based on their experiences and yours will be based on yours, and a lot of times the reference to context is lost. I remember going through your blog before coming to you, and it had an article penned by you titled The First Meeting. Apart from other things, it also spoke about how patients tend to be scared of doctors. And that article sort of made me realize that you were a friendly doctor and it was okay to go to you. It was very important for me to go to someone I could speak to, especially after my previous experience. So for me, apart from all my friends and relatives going to you, this article of yours really confirmed my decision to seek an appointment with you.
Okay, so next one is an interesting one. When you visit a doctor, especially for the first time, do you go there with any preconceived notions, or should one go with any preconceived notions?
So I had a lot going on in my mind when I came the first time. I think as human beings, we always tend to go back to a certain experience or memory that preconditions us to, expect something, irrespective of whether that experience or memory has been lived by us, ourselves, or someone else. I couldn't help myself but go back to a meeting with another gynecologist, which was in fact my very first meeting with one at the age of 18. It wasn't a very pleasant one, and I was wondering if you'll be similar to her. She almost seemed like a school principal for a scared child, strict and rude. Needless to say, you were totally the opposite. I realized then that you should not expect everyone to be the same because of one bad experience.
Thank you, Kanupriya, for those kind words. I'm sure your doctor was probably maintaining a demeanor which looked to you as rude, but I'm sure the doctor wasn't. But, my professor in college used to say that a smile goes a long way. I think that is the best medicine sometimes that we can give a patient. So when someone walks in and you have this broad smile as a doctor on your face, that itself puts the patient at so much ease that the rest of the consult kind of goes off in a breeze. So I guess that is what worked between you and me. But thank you so much for those words. So when you came in for the first time, Kanupriya, for a consult, did you know what you wanted? Or did you want the doctor, in this case me, to actually spell it out for you?
I think I sort of knew what I wanted, but I didn't know how to go about it. For instance, I didn't know what basic tests to start with, how long I could wait before planning a first baby, or was it something I needed to dive into right away. It was important for me to ask these questions because we had just moved to Mumbai, and there were new developments for me personally and professionally that moving to a new city brought with it. So I was actually looking for some answers, and I wanted my doctor to tailor make this journey for me.
This, is exactly what I had mentioned in my previous podcast, that the consult starts from the time the patient walks in through that door. And there is so much of extra things, what the patient wants, what the patient believes in, social factors, what probably her parents want her to do, what her in-laws want her to do, financial conditions, maybe the career that she's pursuing, what are the short-term goals that she has, long-term goals that the couple has. So treatment is based on all those factors, and it would probably be wrong for a doctor to go forward and say, you know what, you require this treatment, because that may not be the right treatment for that person. Which is why that initial discussion is very, very important. And thank you for bringing that out so beautifully. As a patient, would you have any advice for first-time patients who are visiting a doctor?
Yes, I do. I have a few actually. Firstly, I think be sure of what you want to talk about and speak of everything on your mind. Secondly, don't be hesitant and don't hold back. Let the doctor dismiss anything that you might feel is irrelevant. It's better to ask stupid questions than to not ask them at all and keep thinking about them. Thirdly, trust your doctor. The whole journey becomes simpler, much, much simpler when you're talking to a friend and not to a professional.
I think I would like to add one more point in your case: talk loudly, because I think the doctor otherwise would have to practically sit on the table and listen to you because you're so soft-spoken. But that's on a light note. But thank you for again bringing out a very relevant point. I always tell patients, before you come to the doctor's clinic, not just for fertility, whether it's even for pregnancy or anything else, write down the points that are there in your mind. Because, when you enter a doctor's clinic, sometimes it becomes overwhelming. Sometimes it's scary. Sometimes you may just forget what you wanted to discuss. And the moment you walk out through that door, all those questions come back to you, and then you try and contact the doctor over messages, calls, and sometimes the doctor's it's not possible for him to respond, or the answer is too long to give. And again, problems arise. So write down all your questions, doubts, everything that is there in your mind before you walk in through that door. And as a patient, would you have any advice for the doctors as to how they should be dealing with their patients? Any light on that?
Advice for doctors, really? Well, I don't know what to say to this one, especially after my journey with you. Everything was handled so well for me that I really don't know. So yes, no advice for doctors.
Thank you, Kanupriya, but I have something to add to that. Contrary to popular belief, we doctors don't need to be taught compassion. Honestly, we became doctors only because of the compassion and the love for this profession that we have. But yes, sometimes soft skills are what we do need to learn. Probably as we go along through our journey of being a doctor, because that's not something sometimes which is taught in the textbooks. Because sometimes for us, a disease is something we've learned in the books. We know everything about it. So we are sometimes very quick in blurting out a solution and saying, okay, you know what? You need to get this done and that done. And this is how you're going to get pregnant, or this is how your disease can be cured. Not realizing that on the other side is a person who's going through that disease, who probably has no clue about that disease and would like a little more clarity and a little more explanation, and what is most important, in the patient's own language, which the patient can understand. So sometimes I think that becomes very important. Sometimes, again, because of the work that we handle, the huge amount of, calls, etc. So sometimes it does happen that, and we have a team of almost about 7 doctors working with me in our clinic. And I always tell them that you have to put your phones on silent when you're consulting someone. That patient may have taken your appointment maybe 3 to 4 weeks prior. And again, once she's come to your clinic, for whatever reason, she may have waited for 1.5 hours to come and see you. And if at that time, while you're talking to that patient, you're also attending a phone call, no matter how urgent or important that might be, that time is that patient's time. and she may feel that you haven't given enough attention. Sometimes a body language is all that needs to be conveyed. So these are some of the few things which we doctors also need to put in to make sure that the doctor-patient consult, that relationship, that 15 minutes of us together is more fruitful. Kanupriya, you were from another city, Mumbai. How did that change things for you? And what were your concerns, and were your concerns met?
Yes, that was a reason of concern for me. I remember walking into your chamber one day, slightly concerned about me not living in Kolkata, and you saw my face and guessed something was the matter before I had even told you. When I did, I remember you just said one sentence that you're going to Mumbai, so take a Skype appointment with me. We'll be in touch. You can always WhatsApp too. That sort of made it so simple for me. I never ever felt having a doctor sitting across the country would be a problem. And yes, all my concerns were met every single time.
Technology has actually made things very, very simple and nice. And we are now doing consults through our brand Fertility Without Borders for people all across the world. So yes, technology is good and Skype has been wonderful. Being a gynecologist for the longest possible time now, I'm dealing with women all the time. But I find a particular problem. I often find wives coming alone. And honestly, that upsets me a lot. What do you have to say to that?
Yes, it's true actually that a lot of couples don't come together. I see a lot of couples going to a doctor together only once you're expecting a baby and not otherwise. I feel a visit to a gynecologist is a lot about emotional support at every step and making the uncomfortable comfortable. You might be jumping with joy at some stage or really hopelessly wondering what to do next. I feel it's important to have your partner be a part of it all. Yes, sometimes it's difficult for the husband to come in due to work commitments, and in my case, we lived in different cities, but I feel husbands should definitely try and come for the appointments. It's just something you need to be a part of together. You just have to go through it together.
Exactly. In fact, I was just scolding someone, honestly, very badly yesterday, because this lady came in for a first consult a couple of days back for a preconception counseling, and we discussed certain things. I advised certain tests, and she came back again yesterday with her sister-in-law, and all her tests were done, and she said, my husband wants to defer the semen test. And I said, why should that happen? If as men, biologically, we really have a very small role to play. Whether it is fertility or whether it is a pregnancy or carrying a pregnancy or delivering, a woman has to go through all the trouble. If biologically we have a small role to play, at least emotionally we can compensate by being there for that woman. So if the husband has any concerns about why some tests are being done or why his tests are being done, he should be there as part of the discussion. And that is what I scolded this lady all about, that if your husband had concerns, he should have been part of this consult. And in fact, I don't like to do consults if that lady has not come back with her husband's reports being done. I request them to go back, make sure the husband's reports are done, and only then come back as a couple to see me once again. So thank you so much for bringing this point out as well, Kanupriya. So that, friends, brings me to the end of this podcast. Thank you so much, Kanupriya, for being here with me and giving so much of insight regarding the first consult. I think I have learned so much. I'm sure other doctors who listen to this podcast will also get an insight as to how a patient feels and how the doctor should interact. And I'm sure the patients who are listening to this podcast will also understand how they should be going about a first consult. Thank you so much for being here. So friends, if you get a chance, do look up my website www.drrajeevagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries or if you want me to create a podcast on any topic. Do email me on fertilitywithoutborders@gmail.com if you have any queries or if you want me to create a podcast on any topic of your choice. Looking forward to great interactions. Keep listening.